with introductions. Welcome everyone. My name is Tinashe Koronga. I'm a medical doctor from Zimbabwe, also did public health, and I'm one of the coordinators for this. And yeah, I'm really excited to be getting into the conversation with you. And I'll pass it on to Phil to introduce yourself. Then you can pass it on to the next person to introduce themselves. If you can't introduce themselves now, I think Pick, you can introduce yourself. Okay, maybe Tatenda can introduce yourself. And Sunanda, looks like I'm not sure if others are in a position to speak right now.
Oh, okay. Hi. I'm Sunanda Ray, and I'm here with Farai Madzimamuto. So we're both at the University of Botswana, and I'm a public health physician, and Farai is in anesthetics and critical care. Yeah. Anything else you want me to say?
No, that's all. No, it's okay. And Pick and Phil, if you can introduce yourself, that's okay. Tatenda said they're still at work. Welcome, Tatenda. You can introduce yourself in the chat. That's okay. Yeah. So, uh, Pick and Picture and Phil, are you in a position to introduce yourselves for the benefit of Tatenda?
Certainly. Hi, guys. My name is Philip. I trained as a medical doctor at the University of Zimbabwe. Currently, I'm with the Charles River Medical Group in Harare, which is a local research organization, and I'll be starting my master's soon in the UK. Thank you.
Thank you, Phil. And Pick? It's okay. So yeah, thanks. Tatenda has introduced themselves in the chat. Welcome, Tatenda. So the structure of the conversation that I'm proposing, and we are flexible, we're always open to see how the discussion goes. But essentially, this is an open platform for us to help us also understand some of the linkages between climate change and health. So we hope to discuss some of the papers that have been published so far, and feel free to suggest any papers that you find interesting that we can also discuss in the next sessions. And we encourage everyone to really participate and share their ideas as much as possible. And even if you haven't read the paper, I also encourage you to join the conversation, because I think it's an opportunity, it's a platform for us to learn from each other. And I'd like to welcome Ashim. Feel free to introduce yourself in the chat. Yeah. So I think maybe we can start off with a summary of the paper, just to ensure that we're in this first page. So or did people manage to read the paper? So that someone can give us a summary, or I can go ahead and give the summary from the PowerPoint. Did anyone read the paper? Would like to give us a summary from their perspective of the paper? So if not, I think I'll just, oh, go ahead, Sunanda.
No, I was just gonna say, why don't you do it, Tinashe?
Yeah, just go ahead.
You've kind of
That's okay,
skimmed,
thank you.
you've kind of skimmed through it, but I wouldn't feel I'd done a good enough job to be able to summarize.
Yeah.
Go ahead.
All right, that's okay. So so I think I'll just give like a broader, like a summary of some of the key points that I took from the paper, which I think will be helpful for the discussions that are there. So it was sort of it was a review paper that was focusing on they framed it in terms of the 3 grand challenges, and so the summary I think that I'm going to make will just be highlighting what they brought up in the 3 grand challenges. So one of the first one was to promote actions that both reduce carbon emissions and improve health. So under this they talked about encouraging everyone to explore health benefits. So in the paper they were looking into health sector specific and also broader interventions that can be done by all sectors. So they talked about clean energy, and some of the benefits of clean energy also resulting in clean air and reducing some air pollution, really, which will greatly contribute towards mitigating the effects of for example, on respiratory diseases. They talked about cutting carbon emissions throughout the sectors and encourage sustainable transport, like cycling, making cities more cycling friendly, pedestrian friendly, and making a provision for public transport as a way of reducing some of the emissions. And some of the interventions like cycling and walking can also contribute in terms of reducing some of the lifestyle-related chronic illnesses. Then for the plant-based diets, they made a recommendation particularly for the developed world to really consider the plant-based diet, considering some of the contributions that meat and unsustainable the meat production industry is at the moment. Then they also looked at sustainable agriculture and food production globally, and the main recommendations also under this first grand challenge was for health to be central to all policies in all sectors, and for all climate policies really to make health central. The observation was in most of the climate change conversations so far, there has been mention of health, but there hasn't been a deliberate effort to make policies that are specific to health, or really talk about implementation of some of the interventions that are specific to health. Then they also encourage health actors to identify and accelerate climate change mitigation actions that bring the health gains, and also really push for political and financial support for accelerated climate action and sustainable development. Then the sort of second grand challenge that they looked at was building more resilient, environmentally sustainable health system. And here they were really talking about, so they did a health systems approach where they were saying that it has to tackle every component of health systems. I've included an image of the summary in the next slide. So they talked about the encouragement to improve high quality health services for all, and to minimize carbon emissions from healthcare, and also build resilient health system that can be resilient to the climate, to the climate and to the climate shocks and pandemics and other major events. Then they also talked about decarbonizing the health systems through the use of renewable energy sources, optimization use of resources, and particularly for the optimization use of resources, they say it will actually also benefit in cutting the cost of provision of care by introducing things like telemedicine, and it will also improve in accessibility. Then they mentioned that the supply chain is one of the biggest contributors. The supply chain for health procurement and waste reduction were some of the biggest contributions to carbon emissions in the health sector. So they were really looking into sustainable procurement practices. Then so this is just sort of a summary of that's a summary based on the building blocks. We're looking into how we can build climate resilient health systems. So issues to do with research, capacity building, health information, preparedness and management, health financing, transformative leadership and governance, climate smart workforce, and I think already there's some work being done in bits and pieces in some sectors, and we hope to learn to hear more reflections from everyone about this. Then the other challenge was to really looking into implementing public health measures to protect from the range of climate health risks. So they really talked about encouraging countries to look into climate change and health vulnerability and adaptation assessments, then developing evidence-based national action plans and interventions. And some of if you've been following the COP26 and COP26 particularly, health recommendations and action plans, these are some of the issues that they were mentioning. So they were sort of bringing them back to the spotlight. So they were encouraging countries to come up with health national action plans that would include implementation of climate-informed surveillance and response systems for some of the key risks, like extreme heat, infectious disease, food security, early warning systems, then also to look into integration of climate risk into key already existing vertical health programs that are targeting specific diseases like malaria, mental health programs, and also in the maternal and child health care, then also supporting resilience and adaptation in health determining sectors within communities. So that's also looking into things like water and sanitation and other key sectors that are directly related to that. And some of the challenges that they noted as far as implementation of national health and climate plans were insufficient budgets, insufficient human resources capacity, and COVID-related constraints. So this is based from this is data from the WHO Climate and Earth country surveys, where 46 countries responded. Then also talked about insufficient research and evidence, insufficient technologies, insufficient prioritization, and also lack of endorsement by Ministry of Health in some of the sectors. Then for the unique roles that some of the health community can play in delivering transformative change, they said health professionals can be involved in leadership and advocacy. They can also be involved in evidence and monitoring, and they can also be involved in implementation. So yeah, so that was the summary. That was the summary from the paper. So would love to hear any reflections people may have from be it from the paper generally, or generally from some of the themes that they raised, and some of the recommendations. And if there's already some work that that's already going on, I think it would also be great to learn about that.
Can we just jump in, Tinashe, or do you want us to put up our
Yes,
hand?
everyone. It's an open discussion. We're a small group, so people can just unmute and jump in. We're quite a small
Okay.
group.
So
Okay.
Farai wants to say
Okay,
something.
yeah. So first, I just wanted to say this thing about the National Action Plan, because Zim has one, and I don't know when it is due for revision. But they prepared one ahead of that Glasgow conference. I can't remember which year that was now, 21 or 22. But from what I recall, of that, there isn't much on health. There's quite a bit on reducing the carbon footprint and developing solar energy plants and stuff like that in order to reduce the carbon emissions. Yeah, but there isn't much on health other than the early warning thing that people are obsessed about because of malaria and so on. So I think that is something that people can actually take a look at and see how that can be, how more health stuff can be incorporated into the plan.
The other thing is that I can't remember where it was, but in the paper they were saying that each person should look at their workplace and see what kind of impact they can make locally. So that's another way of doing it. I see that Tatenda is a pharmacist, I think. So it would be like, I think because sometimes people become overwhelmed by the scale of what needs to be done. And so, I think that trying to say, what can I do within my own backyard? And then how can I scale that to other people is an important way of looking at it. So I'm trying to think, and then the other issue is that mitigation, like looking at the how much the health system contributes to to emissions is difficult in our context because it's so small. So for example, looking at the supply chain and the transport of the supply chain in most of our countries, Zambia, Zimbabwe, Botswana, even Benin, wherever, they're all we're struggling with the supply chain anyway to maintain primary healthcare. So, it's difficult to say how are we going to, what can we do to reduce that? So I think it's a case of looking at adaptation, education, and the one that we keep talking about is heat stress. So now we're coming back into the warmer months. We could say in our workplace, what will we do if the temperature hits 40 degrees, like it's been doing in Southern Europe? And one of the things that happens is that rich people turn on their air conditioning, okay, and then other people go and sit outside and fan themselves with a book, which is an inequity. But we need to publicize much more why air conditioning contributes to increased emissions, because as it cools down the room, it's chucking out all that hot air into the environment. WHO has a document encouraging people to use fans and wet cloths instead of air conditioners. So that's something. But what will we say to people? What will we say to our clients and our patients, etc., if temperatures go up? So that's something we can look at, because in the process, it tells people that this is a serious problem. And they're medium-term things and they're long-term things, like planting trees around a clinic it may not make an impact in the next 2 or 3 years, but by 5 or 6 years, maybe there'll be enough shrubbery and trees to actually reflect the light. Painting roofs white, that's what some people are doing in some countries to reflect the light. So it's looking at specific things that we feel we can do so that we don't just feel like we don't have power. So those are my suggestions from the paper.
May I?
Yeah, sure,
Thank
go
you.
ahead. Sure, go
Okay.
ahead, Hashim.
So this is my first time joining this journal club, and I think I will be regular in attending it. So developing what you've just said, it's difficult from our sub-Saharan Africans perspective to really know what to do. And I can feel it from, I don't know if it was Sunanda that just talked. I can feel it from her talk, what to do. And my feeling also, I don't know if you share it, but my feeling is that papers like the one we are discussing about now are not intended for us, because whatever they are saying, the audience that they are targeting is definitely not us, actually. That is my feeling. And taking, for instance, the health sector's contribution to the global emission, it's true that the supply chain is one of the main contributor within the health system, but still there, the supply chain is operated by countries that are not African countries mainly. So, and the supply chain exists for profit, not for people, for profit first. So they are ways through which we can solve that problem if we know that we can decentralize technology and allow, not allow, but let's say that way, allow countries to manufacture their own products, but they are not ready to give up their profit for that climate action. So I feel like, and still you mentioned the heat stress, and we are experiencing the highest effect of those hazards, and you just get lost in the whole thing on what to do at your scale. And sometimes even putting the action at individual scale in sub-Saharan Africa is also not really fair also, because we know things that we can do at scale that can contribute significantly to the thing. But I feel like putting a lot of energy on informing people in sub-Saharan Africa, people that are doing very little to contribute to the problem, again, asking them to do more and more again, and etc., is not fair. And yeah, so those are my reflections for now. I can come back later, but those are my reflections for now. Thank you.
Thank you, Hashim, Sunand and Farai. I just wanted to comment on what Farai mentioned earlier about some of the policies. I did take a look at some of the national action plans, and health was really just one paragraph in the national action plan. And so I think there's need, and so there's now like a push for the ministries of health and specific to come up with specific health documents, because I think even in other countries when health was mentioned as a policy, there was no sort of implementation plan for health. Then in terms of the heat stress that Suranda raised, I think one of the things that's been coming up is the issue about people who work outside, because they were saying, what can people who work in construction in the fields do? And I think in some countries, some people have been pushing, they've been fighting against corporations, they've been fighting against policies that may, for example, result in a provision for people not to report for work when extreme temperature is required, because for them they're really thinking about profits. So this, I think those are some of the inequities that came up a lot when you're looking at some of the interventions. That we also have to think about the existing inequalities that are there, and there's also a pushback, because even with when you talk about renewable energies, a lot of corporations are trying to fight against that because they really focus more on the profits. And I think these are some of the things that we can look at, like as how can we amplify this impact to also help in pushing for those structural changes that are being resisted by some of the corporation. Sunanda, you can go ahead.
Thanks. Just in response to Hashim, one of the things that I decided to do was every time I get an invitation or I see an opportunity to join an online discussion about climate change, then I make sure that I bring up these questions. You know, you may feel like you're being a bit of a pain, but I think that's what online agitation or being a
Advocacy.
yeah, well, advocacy, but it's also taking an activist role. So whenever there's a Zoom meeting where people are talking about climate change, and you can actually scan through, there are a lot of meetings now, a lot of people talking, but not, you know, they're not faced with the real issues, but put these things across. So, for example, there was a very interesting discussion on climate change in a THET conference, where they were presenting this issue about the health sector and mitigation. So they actually showed that, you know, the amount of energy that is consumed by using single-use plastic, like gloves, okay? And the thing is that with HIV and hepatitis, this whole issue about using gloves all the time became commonplace. And then even in our countries, people use gloves. And if you don't use gloves, there's even a kind of, wow, you know, you're putting yourself at risk. And then for me, I remember before 1990 or whenever it was that we started using gloves, that we did everything with our bare hands. You know, and you followed universal precautions in the sense that, you know, you had to be careful, but, you know, examining somebody's chest or looking in their ears or even examining somebody's abdomen, you don't have to wear gloves to do that. And when you think about single-use gloves, they're a fossil fuel product. They come in boxes, cardboard boxes. They're carried, in our situation, they're carried from one part of the world to the other because they're usually made in China. They're transported to where we use them. And then we use them and we throw them away. They're not biodegradable. And so that whole chain has been created. And I'm sure for young people, they didn't know it. You feel deprived if you don't have gloves. So, you know, there are things like that we need to look at what we're actually doing. But there's no point in doing things quietly on our own. We have to do them and make a fuss about it. So, you know, like in that meeting, it's hijacking the meeting a bit, but saying, look, you know, you guys can talk about gloves, but, you know, in large parts of the world, people don't have gloves, or people are trying to protect themselves from infectious diseases. What are you doing to reduce that inequality? And then it puts them on the spot, because otherwise people have very cozy discussions about things, and you know, they need to be faced with the reality that large parts of the world don't have access to a lot of things. But at the same time, we are trying to prevent people from single-use plastic. The other example is going to a takeaway and coming away with a plastic fork and knife. You know, that I think I've seen one takeaway where they had a sign up saying, we're trying to reduce plastic waste. Please ask if you need something. You know, all those little packets of sauce and stuff that you get, that's all single use and it's non-biodegradable. There are things like that that we can, by refusing to take the plastic stuff and making a fuss about it, it gets people conscientized about these things.
Yeah,
Over.
thank you. I think you're really bringing in an interesting point of balancing the accountability, like the accountability, like holding the first world and other emitters accountable. And this, I think in the paper, they really mentioned it a lot, that the biggest emitters have to be held responsible for the price that the other countries are paying. And I think there's been a lot of articles that have also been written where they're encouraging the first world to be accountable for their contribution. And this is something that, again, like, as I've also had the same experience as in like when you attend a meeting and you can tell that they are divorced from the reality that a lot of African countries are facing, and even some countries in Asia and Latin America are facing, and partly because in some spaces the climate change conversation has been I'm tempted to say elitist, but also I think because we haven't been putting ourselves in such spaces, our own issues and our own realities have also not been in that spaces, and our own contributions have not been in those spaces. And I think we haven't really treated it as a priority, even if it's affecting us. Because I think when you try to engage a lot of people, there's always that question that, like, what can we do? And I think some of these like practical examples that we can do are very, like, the low-hanging fruits are very useful in terms of when you're now approaching advocacy and raising our voices in different spaces. So I really like those. I really like those recommendations. So feel free to unmute and share your thoughts. And yeah, I can read out some of the thoughts in the chat. People acknowledging that these are meaningful sites and insights, and there was so much to learn, right from clean air systems to livelihoods. Yeah, feel free to unmute if you can speak, and would greatly love to hear your thoughts.
Hi, everybody. So yeah, I did not manage to read the paper, but from what I'm hearing, if I could just take it from what Tinashe was talking about, accountability. Recently, I was reading about carbon credits that I don't know if it has been really, if it had started already in here in Africa, but seems like the West has already started on that. My question was, would you think it's something that would effectively get these big corporates to be held accountable to the carbon footprint, or it's just one of those things again where they can just pay and keep moving and keep producing what they were producing? I don't know. What do we think about that? That's taking it from the issue of accountability that Tinashe was talking about now.
Yeah, I'm keen to hear what people think about carbon credits, because it's something that has come up a lot, and it's also something that's been criticized a lot. Because I was actually surprised that I think one of the places where I'll look up an article, but I think one of the there's this restoration project. I think it's also Zimbabwe is one of the countries where it's happening, where like some of the money for carbon credits are going for planting trees and supporting different parts of the world. But a lot of people have been really saying it's one thing that it's not really holding people accountable because there isn't really much changes that are happening from emissions with that. So yeah, Sunanda, go ahead. And as I look for the article that talks about carbon credits.
Farai,
Yeah, no,
Farai,
the carbon credits thing has really been abused. And the initial concept behind it was that while the high emitters, while they change their technology to become low emitters, in the meantime, they kind of pay this penalty, which is, but actually in reality, what's happened is that it's like a license to carry on to carry on their high emitting, trajectory. And in a similar way, the thing about trees, recently we went on a tour of a distillery, and in the fermentation process, they produce millions of liters of carbon dioxide. And they're quite happily and kind of like joyfully saying, well, we plant trees, so it's okay, we can keep on emitting the carbon dioxide. And it's not the same thing at all. So that's the problem with this, with the carbon
footprint
with the carbon
credits.
credits. And what they have done is that they have, some of the companies have quite cynically gone for the countries with the least technology. Therefore, they don't produce anything in terms of carbon footprint. And, they've been able to trade their, let's say, carbon tokens there, knowing that full well they can emit as much as they like because that country produces nothing. That's the problem.
So
I think that,
sorry.
yeah, I think that there have been some benefits. Like I remember in India, they changed all the public transport, those tuk-tuks were all changed to first it was changed to natural gas, and now they're trying to change them to electricity, and that was funded by carbon credits from the US. But I think, like Farai says, it hasn't sorted out the problem of air pollution in big cities in India. They continue to be very poor air quality, to have very poor air quality. And secondly, it hasn't made the US stop emitting, because they continue to do that. So, it's that kind of thing, that the scale of it isn't at a level where it really makes a huge difference. I know that in Stellenbosch, for example, every time they fly on a conference trip or something, they calculate their carbon footprint, and they have a kind of a grove in the grounds of the university where they plant trees, and once a year they all come together and congratulate each other. I mean, the problem is that individuals, the sort of like 90% of the world's population doesn't contribute to carbon emissions through flying. It's 10% of the population. Of that 10%, I think it's something like 1% who are the frequent flyers, who are the ones who are really responsible. So there's some things which have started coming up, which are a bit more hard-hitting. I mean, the urgency of this hasn't come through yet. So one of the things is taxing people who have private planes. So these people who fly all around, from one, people in the US will not think twice about flying from New York to Washington or whatever. So taxing them at a level where they recognize the, the contribution that they're making. That's one thing. And I was trying to think about our situation. So everybody's pushing tourism, right? And a lot of tourists, the high-end tourists, when they come, they fly in those small planes, those 6-seaters, to go, like to fly over Vic Falls or to fly around a game reserve or whatever. That's something that maybe we could publicize, that this is contributing, even though people will then say, but it's bringing in money through tourism. So, it's that continual balancing act, but just even if we don't win, the process of drawing attention to it will keep people thinking about the impact on climate change. What happened to getting the railways functioning again, so that people, so instead of flying from Bulawayo to Vic Falls, people get the train, the overnight train, that kind of thing. Pushing for solutions. But the other one, I think it's Oxfam that's trying to push a climate change campaign where they're talking about taxing private planes, and there are 3 or 4 other things which I'll try and look up and get back to you. Thanks.
So thank you very much for your insights and comments, and putting the fight air conditioning and this carbon credit thing together. I can clearly see, and from even what you've just said, Sunanda, that basically whatever we are facing now is the result of the dominant way of seeing the world, and even the solution that we are working to are shaped by the narrative of the people that are dominant, the 10% or 1% you mentioned, because they hold the power. So my question is, can we really sustainably address the climate challenge, the climate change challenge, without addressing that power imbalance, the global power imbalance, and how to address that, if that is a way to go? Because ultimately, those who make things happen are those who have the money or the power, the political power. And most of the time, they are the same people. So if they hold the power and they hold the solution and they have the media and they are the one who make the headlines and tell us what to do and know what to do and have access to technology, etc., how to deal? Because ultimately we know what to do, but we are not doing what, at least not at the scale of the problem, as you've just mentioned. It's not about planting tree to compensate for flying. It's not about that, the solution, I guess. So what do you think about that?
Yeah, I think the structural question is very important, because if you look at the climate justice movement, most of one of the things that they're trying to bring out is we really have to rethink how we do things. I know people have been saying, okay, we really need to think about how, like, our economic system, particularly capitalism, has contributed to this. We need to think about new ways of doing things. And some are looking at the historical component in terms of land use, land ownership, and how all these are contributing to where we are today, and trying to move for reimagining new systems, new economic systems. But I think one of the most important things is for us to start getting involved, like, in the conversation, because at the end of the day, if we are passive and not active about it, decisions will still be made on our behalf, and will still not be included in the conversations. So if a couple of months ago, there was the summit that happened in France, where some of the leaders were there. I think there was Ruto from Kenya, and he made a very important speech when he was questioning the issue of finances, where he essentially was saying the current models that we have cannot be we cannot continue using them for climate financing. We actually need to rethink new financial institutions, because the IMF, the World Bank, and other UN agencies have their own structural problems with them. And there's been a huge push for climate reparations, where people are saying there is need for payment of reparations, and that the reparations can go towards building climate resistant health systems. Because when you talk about how can we have resistant health systems, one of the questions that comes up is, how do we finance that? How do we finance the process of going there? So there's also now push for reparations, and why the reparations framing is really to push them to acknowledge to push the biggest emitters to acknowledge that they are the ones who are responsible for most of the problems other countries are facing now, and there's need for them to be held accountable. So I think in different spaces, coming back to the issue of advocacy that Sunanda has mentioned, I think advocacy plays a very important role, and I think HIV is one of the spaces that has shown advocacy actually is resulting in a lot of changes, like in the health sector when Treatment Action Campaign and others really advocated for access to drugs. And I think as health professionals, we can look into the spaces that we get into and the leadership roles that we play in our different countries, and explore how those can be opportunities for advocacy. And we also have to rethink about even funding a lot in the health sector. So one person was noting that you notice that we are talking about building resilient health system, but there hasn't been willingness by most of the funders to start exploring funding that, because most of the funding is not going towards that. So I totally agree about the importance of having this conversation about how do we do things differently. And I think it all starts with us, because one of the things that happens when you bring up the issues, people always ask for solutions. Said, okay, yes, we have raised the problems, but what is the solution? How do we do things differently? And I think that's when really it's important for us to look into, in our academic spaces, research spaces, how can we make what research priorities can we come up with? What new models can we suggest based on the lessons and the impact of a lot of these structural issues on our continent? So it looks like we have about 3 minutes left so maybe with these 3 minutes, people can share their final thoughts, and feel free to also suggest what paper we can look into for the next session as we continue the conversations. Yes, go ahead, Francis. I hope I pronounced your name correctly. Sorry. You can go ahead. We can't hear you, Francois.
Good evening. Can you hear me?
Yes, we can hear you now.
Sorry, it's raining in my area. I hope I'll be able to drive down what I wanted to say. It's just a contribution, and I want to hear people's impression about that. Over the past, we've been talking a lot about planting trees to reduce the carbon dioxide, and you see there are some homes that cannot plant trees. The environment has been built in such a way that they cannot really plant trees. And so what I've been thinking in my organization and trying to implement these last days is to bring a kind of a green smart agriculture with the hydroponics, and they having a lot of garden around in their homes. And not only will it serve as food for them, it is also a kind of climate activity. And so we are planning to take it to many homes and to some schools. And with this, we can encourage schools to use some adapted. Hello, can you hear me?
Yes, we can hear you.
Okay. We can adapt the containers we use in some schools or those that don't have to make sure we plant and keep planting. And as it grows and you harvest, you just keep planting. It finishes, you keep planting. And not only are you getting the best, but I don't know whether it happens in your country. We are at the same time fighting the highly hazardous pesticides that are being used by farmers to grow crops. And so training women to carry out backyard farming with this is a project I'm writing on now, and I don't even know where to submit it, but those are the ideas that just came to my mind. So we should not remain only in saying planting trees, but we can adapt and another concept about this agricultural planting, probably with hydroponics or other materials. Hydroponics may be expensive for some people, but we are adapting some materials to use to make sure women have these things around them, and it instills agriculture. It makes the children to see how the plants of a tomatoes look like, how the plants of a stevia looks like, how the plants of strawberry looks like. So that's my contribution this evening. I don't know your impressions about it. Thank you.
Thank you so much. And I think sustainable food production is one of the very, very important things that we have to think about. And I like sound like you're doing a very good project. And I think you can also share like some of the, if you have social media links where you're posting about this week. I think it'll be great to see how we can also amplify these as some of the examples of the solutions that a lot of people are doing. I don't know if there are any yeah, that's some excellent work.
Thank you.
Thank you.
Yeah. So it looks like we are now on the hour. So maybe before people go, I was wondering if do you have any suggestions on, do you have any paper that we can discuss, we can focus our discussion on, or if you do not necessarily have a paper that you can recommend, is there a theme that you think we can look at, then maybe we can research more about the paper, about a paper that covers that can sort of be, that can help us, that can be a launchpad for the conversation. Or one key issue that came up in the discussion today that you would like us to build more on.
I think that one of the things is, like, I think Hashim said that this paper, even though it's interesting, it doesn't help us move forward. So there's, though, a lot of material on the internet. If people look at what can I do to address climate change, things like that, that a lot of NGOs are now producing like blogs and stuff. So maybe it'll be more helpful if people post ideas that they've seen from other people about what can be done, so that we don't, so that we have practical ideas, so that we don't end up just being helpless, that we've got ideas about what we can carry forward. I've put up the conference on public health so that people can try and, I think it's probably virtual, so that people can try and enroll for that, register for that. And they have got a track on climate change. So really try and challenge them. Because a lot of our, Tinashe and Farah and I were at a meeting of the Zimbabwe College of Public Health physicians. the other day, and it's almost like they have no idea. You know, they don't know what the documentation is. They don't know what people are talking about to do. You know, a lot of our senior health officials are not engaged in this conversation. They're only concerned about whether they're going to get more money for what they think is development from exploring for oil and gas. You know, so we need to persuade them also. We have to keep banging that drum that, you know, one of the key principles of public health practice is to reduce inequalities. So we have to keep reminding people of that. Thanks. Thanks for organizing today, Tinashe.
Yeah. And then, I mean, as far as the paper is concerned, since it's topical and there's a lot of stuff at them that's coming out now, this thing about heat and climate change,
Heat stress.
heat stress,
Mm,
about heat stress and health,
yeah.
that would be a very useful thing, because that's affecting everyone, not just in the north at the moment, but even in the south also. And we don't have the data.
All right, thank you so much for the suggestion. So just before people go, so there's some people who had asked for an audio to be shared of the meeting. We didn't manage to come to the meeting, but we're interested to join or hear the reflections. I wanted to find out if there's anyone who has any concerns around that, because we don't want to share any like this audio discussion to anyone without your consent.
Yep, we gave consent at the beginning to
Okay.
record and disseminate. Yeah.
All right, that's okay. Thank you so much. I'm going to put my contact details in the chat. Then, yeah, I'm going to put my contact details in the chat, and people can feel free to share their ideas, even about the future spaces and how we can also reach out to how we can improve the space, what else we can discuss, and the different platforms that we have. We have a Facebook group and a WhatsApp group where we're also having some of these conversations. So if you also want to be added onto those, just send me a message on these. For the phone number, I'm currently using it for WhatsApp at the moment, not for calls. So you can send me a WhatsApp on that number. So thank you everyone for taking time to join the conversation. And I think the hope is for them not to end the conversation, not to just be conversation, but to actually inspire practical actions in your workplaces, and also to feel less helpless and hopeless afterwards, because of like learning from some of the work that being done and some of the recommendations that being done, and looking forward to seeing you in the next monthly, in the next one, which will be in October. And I think you already have it on the calendar because it's a recurring and we can use the Facebook page to continue the conversation, share ideas, share resources. And if you send me a message, if you send me a message on the contact details, I will send you information about joining the Facebook page and the WhatsApp. And feel free to share resources, events, and the work that you're doing on those platforms. Have a lovely day, everyone. Thank you.
Thank you, Tinashe.